My name is Professor Bill Cumming, and I'm a hand and orthopaedic surgeon. I'm proud to be a professor of orthopaedics in two countries, Australia and Indonesia, and I have some 60 years of experience in hand surgery. It goes back in evolution to us standing up as humans. We're the only upright people who are plantigrade except for the bears. And in so doing, the human being opened up like a flower. Our upper limbs are quite different to our lower limbs, not in contact. In so doing, we wanted to achieve mobility in our shoulders because we have to carry babies, spears, etc. That's the reason why people are right-handed, because the baby wants to be on the left side where the heartbeat is. And we have more right-handed people for that reason. At the same time, our hips are different to our shoulders. Our hips are a nice deep ball in the socket, rarely ever come out of place or dislocated, whereas our shoulders are a tiny little socket and a great big ball, are inherently unstable and will come out easily, and dislocated shoulder is extremely common. The significance of this for us in our lives is that our muscles around our shoulders and the ligaments are what control stability. And we must have very strong ligaments and muscles around our shoulders, otherwise they will dislocate. And so as we age, these tissues gradually are less supple and have problems. Not only that, when we open like a flower, like this, the direction of our rotator cuff is out like this, whereas our hips are down like so. And the nutrition to our supraspinatus muscle and the others is diminished in comparison to what's in the hip region and elsewhere in the body. So our supraspinatus wears out. It wears out naturally, so that if you just take an example, as people age, something like 50% of people at the age of 50 have tears in their rotator cuff, either half of them complete, half of them incomplete. And they don't know, they're all asymptomatic. So when we stress our shoulder and we assess it and we find a tear in the rotator cuff, we have to decide whether or not that's been caused by the stress or whether it was already happening. And this is why our rotator cuffs wear out and why we injure them at work. The work relationship of shoulder problems is always a complicated matter. The question of pre-existing pathology, therefore, comes up, as I've explained, because of the aging of these tissues. There are some circumstances at work in which we know that this stresses our shoulders abnormally. People, for instance, who work at height with their arms above their head place them in a very difficult situation and place an overload on their surrounding musculature. People who install ceilings or who drill into the roof doing various tasks produce shoulder problems quite commonly. This uncommon situation regarding shoulder injuries at work was the reason why a previous edition of AMA 5 required that there actually be an injury or a significant incident to a shoulder. And there is no doubt, of course, that falling on the outstretched hand places a significant load on your shoulder, and on some occasions even falling heavily into a wall on the point of your shoulder or falling heavily on your side onto your shoulder can cause you pain and aggravate. And I think the major word here is aggravation of some pre-existing condition, because I've outlined the incidence of this age change in the shoulders which pre-exists in a high proportion of people. When somebody attends for a medico-legal assessment and has had pain in their shoulder, it's important to recognise whether this pain came on slowly or whether it came on with an incident. And we also have to decide whether this is a symptomatic aggravation or whether there's actually been change in the pathology in the joint. around the joint in the ligaments and tissues. That means if there's been a change in the pathology, that there has been a very definite work-related phenomenon which has altered the tissue circumstances. A symptomatic aggravation one would expect to subside in a reasonable period of time when you stop aggravating it. If you keep hitting your thumb with a hammer, you'll make it sore, and the good idea is to stop. I've only dealt here with the question of rotator cuff degeneration and tears superimposed or actual in the shoulder, but there are many other conditions such as instability, which can occur following injury or can be inherent unstable. People have inherent ligament laxity. Asian people, the beautiful Balinese dancers, demonstrate this. Asian women can put one hand over the back of their neck and touch the back of their other hand up their back. We don't. Caucasians have that mobility. And so this question of laxity comes up. There are pathological conditions also which involve tissue laxity. Ehlers-Danlos syndrome and many others describe this, but some families and some races are just inherently more mobile. Therefore, it's necessary that every client, every work-related patient receives the benefit of the doubt, and they all need to be assessed on an individual basis, because you can see that there are both general and local factors in the presentation of people with shoulder conditions. And once again, the work-related patient who develops shoulder pain and is working hard automatically, reasonably assumes that his work is a factor, and he's right, commonly. But whether it's a causative factor or an aggravation, symptomatic or pathology changing, you have to try and work out and decide. And therefore, in these circumstances, it's very commonly necessary to make an assessment of the pre-existing condition and this incident or onset of problems, and to apportion this in a fair and reasonable manner. For more information on this, I would refer you to a very important tome, a book. It's the second edition of the AMA, that's the American Medical Association, book on causation. This has the same authority as AMA 5. And in this, considerable discussion takes place about overuse. That is, if I have one arm in a sling and I'm using the other one, can that cause pathology or injury to my other shoulder? And that needs to be considered. I would point out again that the client receives the benefit of the doubt, but in terms of the contralateral injury assumed, it's common that all of the degenerative changes we've talked about are bilateral. They're present throughout our bodies and equally in both shoulders. Perhaps more in our dominant side because we use it more. But it's necessary for us to be fair and reasonable. But overall, the opinion of the American Medical Association book on causation is negative in terms of overuse producing actual pathology in the other shoulder. Sure, symptomatic aggravation, reasonable, and maybe long-term, and requiring treatment. And if it won't settle, then the treatment is reasonably accepted as work-related and related to the contralateral shoulder, which has been injured. Thank you for having me today. I really got tidied up, wore a dark suit and wore my very special tie, of which I'm very proud. This is a tie of the Carousel Club. It means that you've been a past president of one of the orthopaedic associations of the English-speaking world. That is, England, South Africa, Australia, New Zealand and America. Now, we thought that the term English-speaking world was offensive to the rest of the world, so we wondered what to call it. Now, a friend of mine from England, a funny guy, said to me, we should call it the Carousel. And I said, why? And he said, well, every year, the association elects a little old man and a little old lady, And it's like a fairground carousel. They get on 2 horses and they go round and round for a year, doing nothing but visiting other countries and enjoying themselves and being totally unproductive. At the end of the year, they chuck them off the carousel and put another little old man and another little old lady on board. So we thought this was not offensive to anybody, and so I'm proud to be a member of the Carousel Club. I'm very proud that we designed it and my son drew this, and it was made in Sydney, and it's now handed out every year to around the world to the past presidents of those associations.